Our healthcare system surge capacity is at a threat. Our healthcare workers will do everything we can to try and address that threat, but we really need the public to help us also address that threat.
Quebec adding a record 9,397 COVID-19 cases in the last 24 hours. The province seeing a 157% increase in cases over the last 7 days, adding more than 3,600 cases since last week. Measures Premier Legault added Wednesday didn't go as far as many thought. Gatherings of 10 are still allowed for Christmas, but he's urging people to cancel their plans. And as of December 26th, that number goes down to 6 people or 2 family bubbles. Same if you're going to a restaurant. Overall, he's hoping people respect health measures to help fight this 5th wave. But will they?
I actually have faith in my colleagues in the community, because at the end of the day, a society is based on its citizens, and I think the overwhelming majority of citizens want to see us get out of this mess.
Montreal has seen a 60% increase in hospitalizations over the last week. The system is currently preparing an additional 550 beds to accommodate COVID-19 patients, though that could ramp up to 1,000. Omicron is particularly hitting young Montrealers aged 18 to 44. The age group accounts for 60% of the cases. The city's public health director, Dr. Mylène Drouin, saying social events could have been a spreader, like private events in apartments, but explaining that officials need your help.
As you may understand, public health doesn't have the capacity right now to do tracing for all cases. We're going to continue to do some tracing, but only for specific cases and outbreaks with vulnerable groups. So we're asking the population to collaborate with us.
1 in 5 Montrealers getting tested are turning up positive. If you test positive, contact anyone you came in close contact with in the last 48 hours, meaning you were indoors together for at least 15 minutes without a mask. And you must self-isolate for 10 days. Public health encouraging people to use free rapid tests and only go to a testing site if they have symptoms. Facilities continue to be overwhelmed.
There, I'm a little bit more skeptical, simply because contact tracing and public health measures is, by definition, supposed to be a specialty act. It requires an expertise by medical or clinical professionals. That's why we have a public health agency that has supposedly people who are trained in this to be able to do that.
Reduce your gatherings, reduce your contacts.
What the government is decreeing in terms of the public health measures, such as making sure that you are masked appropriately indoors, that you limit your gathering, you try to distance yourself, I think that those will be, that falls onto the responsibility of the public to be able to adhere to it. I have confidence in my fellow citizens that they will.
Not overwhelm the healthcare system, Dr. Vinh says follow COVID-19 measures. It's key.
I'll give you a secret, okay? Healthcare workers are resilient. When it's time to bend, we bend. And when it's time to bend more, we bend more. But there will come a point when the bend becomes a break, and there's nothing we can do. But this is not a one-sided battle. We need support, and the support comes from the public.
In Montreal, Pamela Pagano, City News.